Today we will be talking about one very common question that keeps on cropping in parents' mind, and that is what will happen if we do not take occupational therapy sessions regularly, or what will happen if I miss some occupational therapy sessions. So I want to clarify this dilemma which parents go through on and off during their therapy sessions, because if parents have a child with some problem and they are taking occupational therapy, most probably they will be needing occupational therapy for for a long time, and occupational therapy sessions can be for a couple of days also in some cases, but most of the time parents require long term occupational therapy. So I want to clarify this dilemma which parents have. To make it very clear, I will talk point wise. So the very important point is the time of early intervention gets wasted if therapy sessions are not regular. What I mean by time of early intervention is, if you get a child at the age of 3 years for therapy, chances that the child will develop normally or in typical manner is more if therapy sessions are regular. If therapy sessions are not regular, that time gets wasted. The results which you might have got in couple of months may get exceeded to couple of years. So the time of early intervention gets wasted if therapy is not regular. Uh, Another point is, the primary problem for whatever you are taking your child for occupational therapy, that primary problem remains the same. Suppose you are taking your child for handwriting issues, and if the sessions are not regular, and if the home program is not followed, then the primary problems remain the same, or there may be changes, but that won't be that significant that you can stop the therapy. If you are in the process of ongoing therapy sessions and if you miss on some sessions, primary problems won't change to the extent you want them to change. Third point would be, secondary problem arises. Like for example, if you are taking occupational therapy for a child who is not able to sit, now 6 months got wasted because therapy was not regular, you could not attend, or you skipped many sessions for whatever reason. If therapy was not regular, what happens is secondary problems crop in. The child has grown with respect to his physical form in 6 months. His spine has got extended, how much ever it must be, or he was supposed to reach some other milestone in 6 months which he has not reached. So the primary problem of not able to sit is there, but the secondary problem, that the body is not able to cope with the growing growth of the body, uh, like example, his spine may go on one side, he may develop some awkward posture, or his hands may not function appropriately. He may lift his shoulder up, or he may move his hand in some awkward fashion. So secondary problems crop up. If you are taking a child for handwriting issues, suppose his handwriting has not improved because therapy sessions were not regular, so bad handwriting stays, but along with that, his competence as a student, his interest in academics, maybe his spellings, and his ability to give his best in his studies, all that will go down. So secondary problems crop in. Then you have to take therapy sessions for his confidence. You have to take therapy sessions for his spellings and his interest or his academic performance. So that increases your burden because secondary problem crops in because primary problem was not solved on time. Another thing is, parents' motivation goes down. If you see that you are taking therapy for a year, though it was not regular, because we have a tendency to blame others than blaming ourselves. So parents feel that I have been taking therapy for a year, but there is no change. What you need to reflect upon is, how was your therapy process? Whether therapy sessions happen regularly, whether you were following up with the home program, whether there was healthy discussion between you and the therapist. So all those factors need some attention from your side. Uh, then interest of the child also decreases. Like for example, a child came for occupational therapy session today. I was very prompt and very disciplined with my therapy session, and my this child adapted to my kind of discipline today. But then he did not come up for therapy in next 2 months. After 2 months, when he comes back, he knows that here I have to stay only for 45 minutes and I don't have to come here often, so I may get away with the session by some misbehavior. He may try some new wrong behaviors with the therapist, or he may just try to escape or avoid the work which he is being given by the therapist. So the interest level of the child decreases. He is not that sincerely involved in the therapy process as he should have been. Uh, Another very important thing is professional commitment. Professional commitment from the therapist or professional involvement of the therapist also may fluctuate if a child is not attending regularly. Therapist might think, oh, these people are not regular. Oh, this child is not regular. And therapist may also not give his best as he would have given if you kind of pressurize the therapist that I am coming for 6 weeks, I'm working hard with the home program, and things are changing, but it is changing in this direction, I want it in this direction. So when this healthy transactions, healthy conversations happen with the therapist, you will get good results, but all this should happen. uh, Another thing is, if you attend therapy sessions regularly, then what happens is it's a win-win situation for everyone. Parents are motivated because there are results. Child is happy because he is now competitive, he is interested, and it's a general tendency that we are interested in things we are good at. So if a child is good at something, he will be interested in doing those things, and he will be progressing ahead, he will be learning ahead. And therapist is motivated that yes, I am helping this child and I'm giving my professional best and I'm getting my professional results. The therapist is also happy. So this is a win-win situation. Also, parents have to consider that attending irregular sessions, that financial factor also comes somewhere in your therapy process. Even if you say that for my child money is not important, I will spend as much as I want. But still, if you are going for a therapy for a year, you have spent for a year, and if you don't find results to be promising, you tend to get discouraged, and that financial burden also adds up. In a nutshell, it would be a win-win-win situation for parent, child, and therapist if therapy sessions are attended regularly, if they are not missed often, and if for any unavoidable circumstances you are going to miss your occupational therapy session, it is always advised take proper home program from the therapist, know right approaches about your child, and try that during that break period also the child is going through his developmental process and he does not stagnate at one place. Thank you.